I am Julianna Lippert-Keck. I have been a physician for 16 years. I specialize in wound care and hyperbaric medicine. I was born and raised in rural Missouri. I did my undergraduate and medical training at the University of Missouri, Kansas City, and I did my residency at Mercy in St. Louis. I'm board certified in family medicine. I was the Naval Medical Officer for 15 years. I specialized in diving and undersea medicine during that time. Which is a really great opportunity because not only did we take care of wounded divers, but we also were the chamber for the Naval Medical Center that was there. So we took care of all the active duty and retired personnel, and we were taking care of vascular wounds, diabetic wounds. We were taking care of everything from brown recluse spider bites to salvaging flaps, working with our surgeons to salvage flaps. So really got to see a broad spectrum of wound care and how hyperbarics can really make a difference for that. The types of procedures that we do here at the Wound Center, we do a lot of debridement. We make sure that the wounds are clean, so we'll clean the wounds, we'll debride the wounds if necessary. We will do transcutaneous oxygen monitoring to check somewhat of the vascularity status of patients and to see if hyperbaric oxygen can help as well. We do hyperbaric oxygen therapy for certain indications. The type of patients that we see here at the Wound Center are patients with chronic wounds, so wounds that are not healing due to some other medical problem, whether that be diabetes, whether that be vascular disease, whether it be injuries that don't have good matrix in that wound for them to heal. Sometimes it's surgically related as well, and with the flap, sometimes we have to get involved to help those because they need more oxygen in the wound. I really love this profession. I wanted to be a physician since I was 5 years old. I was always that child that whenever they asked, what do you want to be? It was consistently, I want to be a doctor. I just love that patient interaction, and I really like not only talking to the patients, but listening and finding out where the patient comes from, where they are in their medical understanding, what their situation is, because every patient is different. So when someone has a chronic wound, it doesn't just affect the patient, it affects their caregivers, it affects their family, and it affects their mobility. They may not be able to get out and do those things that they want to do. So it's very rewarding for us to be able to sit down with a patient and find out what their limiting factors are, what their goals are, what they want to get back to, so that we can help them achieve those goals.